I don't go to the doctor when I should because of the cost. I don't do things they want me to do because of the cost. I don't want to leave my family with so much debt that they can't recover. Leroy F., a lung cancer survivor. Listen to another from Wayne J., a kidney cancer survivor. My wife and I lost our home after struggling to keep it, but there was no way we could with me not working and with the medical and medicine bills piling up. People have been writing to us, telling us their stories, sharing their opinions. We're listening. And as we always have, we're working to make a difference. Everything we've done over the years is paying off today. Cancer incidence and cancer death rates are both dropping, and the tide seems to be turning. And then you read something like this, and you know our battle to save lives isn't over. We had insurance, but we had a large deductible and copay. The cost of Taylor's treatments over the next year was $250,000. Even though we only had to pay a percentage, 20% of an astronomical figure is astronomical. What should healthcare in America look like in the future? We don't pretend to have all the answers, but we do know many of the questions we all should be asking. Is health coverage available to everyone? We know it's not for 47 million people living in America who don't have insurance. Is coverage adequate? Not for the untold millions of people whose insurance does not cover the most effective cancer prevention, early detection, and treatment options offered today. Is it affordable? Too many people have to choose between paying for their cancer treatment and paying their mortgage or buying food. Is it administratively simple? I've been an oncologist for 20 years. I know the challenges people face trying to figure out what doctors they can see, which tests and treatments are covered, and which aren't. Making dozens of phone calls and filling out endless forms, all when they're facing the biggest challenge of their lives. Lots of people have lots of ideas about how to solve these problems, and we need to consider them all. We will listen, and we'll call out the problems that need to be addressed. We won't propose a specific solution, but we will take action. We already are. We're constantly updating cancer.org with the latest, easy-to-understand cancer information to help people learn about their diseases and their choices. We're establishing patient navigators in city after city, specially trained American Cancer Society staff who can help people get the care they need before and after a cancer diagnosis. The American Cancer Society Cancer Action Network, the Society's sister advocacy organization, is working to increase funding for the National Breast and Cervical Cancer Early Detection Program so that low-income, uninsured, or underinsured women can have the tests they need to detect cancer early, when treatment can save the most lives. We also have a new website devoted to our efforts to ensure people have access to quality cancer care, where they can learn more, tell us their stories, and take action. You've probably seen our recent print and TV ads. They stirred up a lot of comment. And that's exactly the point. We're not trying to tell people what to do, but we are telling people, anyone who will listen, we need to talk about this and solve this and save lives. Lives like Stacy M's mother. Stacy wrote, "The doctor said she probably had cancer for approximately 10 years. Unfortunately, she did not have adequate insurance coverage that covered routine screenings. If there was adequate insurance coverage for preventive measures, then countless lives would be saved." We're listening, Stacy. And while we don't have all the answers, we're not afraid to ask questions that will encourage change. We hope you will ask them too.